Welcome to Primary Care and the new Medical Quarterback series. I'm Bambi Francisco Roizen, founder and CEO of Vator, one of the hosts and producers of Invent Health, an event series running for 4 years. And the purpose of these events is to take a deep dive into one topic. This time we've been focused on primary care. Today we're hosting our second webinar as part of our series for this topic. We had our main event on November 17th, where we had a CEO panel focused on changing economics around primary care. We had a panel of VCs and corporate strategists discussing what they're seeing as investment opportunities in this space. And then we had a panel of chief medical officers to learn how their jobs were changing in light of the new primary care access points. Those would be the new tech-enabled clinics, the proliferation of just retail clinics, the virtual options such as chatbot navigators and telehealth. We have a number of videos and news posts summarizing the panel. So go to vator.tv/news or vator.tv/events, and you can find a listing of all of those videos and posts. We did host our first webinar last month as part of this series, and that webinar focused on how employers are rethinking prevention and wellness for their employees. And it's related to what we're discussing today, which is the future of fitness. Fitness, as we all know, is a big part of prevention and wellness. And I am going to be honest, what struck me during our last webinar, and Archana was on that, our last webinar with chief medical officers at Unilever and PepsiCo, is that during this era of COVID, the messaging from our public health officials has been far too much wearing masks and getting vaccinated as COVID prevention. And I think we're missing an opportunity here. There's very little time spent encouraging true long-term lasting prevention, such as fitness, diet, healthy habits around sleep, mental fitness like prayer and meditation. The chief medical officer at Unilever estimated that about 85% of her employees seriously affected by COVID had comorbidities, and this is reflective of the broader population. One study showed that 93% of COVID deaths were associated with pre-existing comorbidity, the top 4 being hypertension, diabetes, cardiovascular disease, chronic kidney disease. And the leading cause of hypertension, well, besides age, being overweight, being inactive. So being active has so many natural benefits. It reduces stress hormones like cortisol and adrenaline. Regular exercise releases endorphins, which boosts self-esteem. Exercise improves sleep, lowers blood pressure, strengthens your heart. This is a natural way to make our bodies stronger against not only COVID, but chronic conditions that weigh on our country. So the message we should be doubling down on isn't wear a mask, but get healthy. Take zinc, ginger, potassium, vitamin D, get exercise, feel grateful. The CDC says that if we change our diet, if we exercise more, if we don't smoke, we can reduce 80% of these chronic conditions and therefore reduce fatalities with COVID and potentially future diseases. So my hope is that, with all of you tech fitness enthusiasts here, we will have real discussions around prevention that really matters. Before I hand this over to Archana, I just want to thank our sponsors, a couple of those who really do believe in fitness and true prevention. Pivot, which is an AI-enabled digital therapeutic solution to help people stop smoking. And then there's Forte, which produces live stream on-demand fitness classes for some of the nation's largest gyms. With that, I'm going to turn to my co-host, Dr. Archana Dubey.
Thank you, Bambi. And I am a clinician by training, Dr. Archana Dubey. I work as a chief clinical officer at AliveCor, which is a heart health company, and also part-time chief medical officer at HP, leading the population health strategy. And I cannot stress as more than what Bambi shared, that we already were in a public health crisis before we arrived into pandemic, through cardiovascular, through oncology, through musculoskeletal problems that were impacting on the entire population. And then the COVID epidemic or pandemic became a wake-up call for all of us to really, truly make a fundamental change across all of our population. This is a public health issue. It is no longer to be looked away because it affected people with cardiovascular illness far worse than people who did not have these. So with that, I would like to start the conversation around what you can do, how you could stay fit, and what are the solutions out there, and who are really powering up the investment in that direction. And really excited with the panelists who are here today. Typically, how we run our Invent Health platform is we would like our panelists to share and introduce themselves and share a fitness hack. You could do a better job introducing yourself than I would. So, and I'll go around, since we are in Zoom, go around the tiles clockwise around me. Justin, you are first in introduction, and then we'll go down to Lauren, Kevin, Emma, and Mark.
Perfect, and so glad to be here and with such other amazing panelists on the call. I'm a physician and partner at GSR Ventures, where I focus on investments in health technology, and we certainly include fitness within that bucket, as so much of what Bambi mentioned today already is important of improving health outcomes and really making a difference. In terms of background, I started at Stanford as a physician. Previously, I was a computer scientist. Got launched our Center for Digital Health, spent some time at Apple to work with our healthcare team on startups of my own. And notably to this conversation in terms of fitness, I'm a former professional athlete and ultimate Frisbee world champion. And in terms of a fitness hack, one thing I continue to do is keep moving, be flexible with yourself on what the workout is, but make sure you at least get something in at least a few times a week.
Excellent, thank you, and congratulations for being the world champion. I did not know that from your last panel.
it's a small sport. It's fun.
No, it's very intense, by the way. So, Kevin, you're next.
Hi, thank you all for having me. I'm Kevin. I'm an investor at MGV. We focus on typically early stage software investments. We've done some stuff around the preventative care or access space. We're early investors in a company called Modern Health that was focused on helping large corporates give mental health benefits to their employees, and also kind of access to more healthcare. We backed a company called Hey Doctor that got acquired pretty early on, but they were working on giving people quicker access to stuff, mostly like prescription meds that are not on the riskier side, where you typically have to go in or call your doctor, go into a doctor's office to get a prescription, like birth control and some of the easier stuff where there's virtually low risk of abuse and low risk of harm. So we'll typically do pre-seed, seed, usually one of the first investors in a lot of these companies. And I guess what else, the health hack. I used to play sports in college, wasn't quite as impressive as Justin, but played lacrosse and pretty much everything else that I could find time for. And it's kind of the same thing for me. I like to track everything and kind of figure out what matters, because after you stop playing sports at a high level, it's kind of weird to figure out how to work it into your day if you don't enjoy going to the gym, or you don't enjoy running, or you don't enjoy going to classes, which a lot of people don't. And I think a lot, like the weird thing that happens, you don't really know it, is that your fitness doesn't disappear immediately. Your flexibility starts to go, strength starts to go, and it's kind of a slow roll. And all of a sudden, you're looking back and saying, well, you used to be in such good shape, what happened? But if you can kind of keep track of what you've been doing and some various metrics around that, I think it's super helpful. I also got a dog, and that helps me to move around a lot.
Always.
Got a lot of energy.
Yes. And that's such a good insight that, your ability doesn't go down rapidly. And so some of these things starts to go down, which is flexibility and other aches and pains. Thank you. Lauren, you're next.
Hi, thank you so much for having me, Justin and Kevin. Justin, you are a hard act to follow. I'll have to start with that. Got quite a rap sheet there. Thank you so much for having me today. My name is Lauren. I'm the founder and CEO of Forte. We are a B2B white label solution for typically large gym chains and people in the fitness space to create an end-to-end white label digital platform for their members. So we power the digital for the UFC, the YMCA, the Edge, the NFL Players Association, Under Armour World Headquarters Gym. So some awesome brands to obviously create an omni-channel offering, just like the work from home situation has forever evolved, so has working out from home. So gyms need to facilitate a way to meet their members. I think the biggest opportunity or the most exciting one for me is to Bambi's points that she made earlier so well, is most people don't work out, right? And there's a high barrier to entry going into a place that's super intimidating. So yes, there's 60 million people in the US that are members and they're active, but I really think that digital is a means to getting more people into the funnel, kind of lowering that barrier to entry, because they live around the corner from these places. So that's sort of my, dream from this company is really increasing the funnel. As I also was an athlete growing up, I think, Justin, you kind of nailed my hack. It's get it in, like, even if it's 10 minutes, I go for a run to the West Side Highway in New York and back. It's 6 minutes, but if I'm going to shower, I might as well do something, or a jump rope for 10 minutes. So I think just doing it, keeping your body programmed to want it and desire to work out is important. And also just like starting somewhere. So no matter where you are, if you want to learn to do a push-up, you do one every day. That's the amazing thing about your body. It doesn't matter who you are, that, if you do one, by the end of the month, you'll be doing a couple and you'll progress. And so I think just, that's the amazing kind of thing that you get from it, no matter who you are, if you stick with it. So finding like a new skill or thing to be able to really track that you're, having that progress, I think is also fun as, whatever level you are, whether it's a double under or push-up or what have you. So always finding new things to just show that you can get stronger and get it in, and no excuses, even if it's a super short workout, it's important to get it done. Yep.
That's awesome. Thank you. Thank you so much. And Emma, you're next.
Yeah, thank you so much for having me. Those are some great hacks. I can totally relate to those hacks, actually. Look, it's great to be here. I work for a company called Peerfit. We are really in the digital health space, or really mostly fitness. We've built a network of fitness studios all across the country with great partners like Lauren and Forte, but that network is essentially gyms and studios similar to a provider network, where now our users can choose where they go, when they go, and whom they go with, without having to become members of all of these different facilities. I can do yoga one day, I can do Pilates the next, I can go to CrossFit the next. It's entirely up to me as the end user to choose those experiences. The interesting thing about our model, and I think what makes us unique, is that our clients are first and foremost health plans. The health plans are kind of getting more and more innovative about the solutions that they're providing their members, I think, because they've recognized the things that have already been brought up today. How do we attract folks that wouldn't normally walk into a gym? Those environments are intimidating, right? I don't need to go to the gym and see someone flex in front of the mirror. I find that intimidating. So how do we provide experiences that are going to be attractive to kind of everyone on the spectrum, regardless of where they are in terms of fitness? And so we provide those experiences. And again, they're mostly to health plans, but we have a B2B offering as well. Our experiences are not only in person, but digital as well. Obviously, the current environment really does pose very favorably to offering things that folks can do from their home, or in an environment that they feel safe and comfortable in. And so we have doubled down on those experiences, and we'll continue to do so as we kind of grow and come out of this new world, into this new world that we're all kind of starting to navigate ourselves. I've been in the industry forever. I come from the broker side, spent some time on the carrier side, always have been in corporate and employee health and wellness. So kind of love it, actually. Paid my way through college as a personal trainer. So my hack, I actually have two hacks, if you will, if I'm allowed two hacks.
Yes, you
are. The first would be to get it done, your exercise done early. I have learned through my career and time as a personal trainer that no one is going to call you at 5 a.m. and invite you to happy hour. But if you save your workout to start at 5:30, there's the likelihood that someone may call and invite you to happy hour. And it's really easy to prioritize that over going to the gym or for a run. So my second hack would be to find someone to work out with, have that accountability buddy. We are Peerfit for a reason. We do put the peer in in Peerfit. You would say peer in Peerfit. I know it's a cliche, but most definitely we believe wholeheartedly in it, and having that person that is going to meet you at 6 o'clock in the morning for a run or a workout will make you get up.
Yeah, that's awesome. Thank you, Emma. I have Mark next.
Thank you, Mark Wan. I'm a founder and managing director at Causeway Partners. We're a venture fund that focuses on sports and fitness. And through that and other investment activities, we're involved, I think, in quite a few properties across that spectrum. We're investors in Peerfit, this company, Zwift, a cycle training platform, Freeletics, a digital training app, #1 in Europe, but also have investments in things like Athletic Greens, Momentous, a premium supplement company, to even fitness apparel like Tracksmith, which is running apparel, and Stio, ski apparel. And so a whole spectrum of things related to, I would say, fitness and health. For myself, I've been a VC for 30 plus years in Silicon Valley, principally. I spent 20 of those years actually in healthcare, focused on healthcare, mostly around services. So sat on everything from hospitals and clinics and mental health facilities and rehab centers, but took a little bit of a detour as I got involved with professional sports, which led, as I just described, to forming Causeway with a few partners and friends. So that's sort of my brief background. And I guess on the hack side, looking at this group and hearing from this group, we're in the fortunate camp of, I think, people who have a history of being athletic and active and probably don't struggle quite as much with, how do you do that workout? How do you get it in? Because I know for me, I enjoy doing it, and it's just a question of whether I can find the time. And so the hack that I would share or like to share with people is really trying to find something that you enjoy. It sounds simple, but and don't even have to think about it as a workout, right? Is it going for a walk or a hike? Walk the dog, get out and ride your bike to the grocery store instead. But just being active, as opposed to thinking about how do I get this workout in, whether it's 20 minutes or 50 minutes, get to the gym, do it at home. But just find something that's active that you enjoy doing, and then it'll be a lot easier to get it done. So.
That's great. Yes, and it is simple, but it is so on point. How about you, Bambi? What's your hack?
Well, my hack is, I'll give you one piece of advice, because everybody seems to be sort of giving advice, but I'd say consistency, sort of like what Emma said, is I think just have a consistent time that you're going to work out. Probably it's probably more likely that you would do that in the morning. But my hack now, since it's the winter time, is I live in Tahoe 4 days out of the week, because my youngest son is a competitive skier, not world ranked, but he is nationally ranked. So my hack now is actually to get on the lift and take him on this commute to get to his ski team practice. So I get to do that takes maybe 30, 45 minutes, which is nice. I get a couple of runs in the morning, and then I go to work. So it's a nice way to start the day and then end the day, because I have to pick him up.
Yeah, that's awesome.
And what about you, Archana?
Well, mine is what Emma was talking about, in going every morning to Stanford Dish to complete the trek, and then start my day thereafter. And then, of course, the other thing is standing desk. Like, that is something that's an important attribute. I mean, somebody needs to give them a Nobel Prize to come up with this solution. Maybe probably saving a lot of lives and cancers doing that. But one of the advice is that to prepare for your exercise the day before. So you have your shoes at the right place, your car keys at the right place. So you're not having those friction points, that the moments that talk you out of the exercise plan, and then just go in as a second nature to do your exercise.
That's why I live in my gym clothes in case anybody invites me to work out.
Perfect, perfect.
Well, that's
I
it. Well,
can
now on,
always
if with everyone on Zoom, you could also have your gym pants on, you know.
Exactly.
Class. But
Exactly.
everybody's ready to go. Okay, so, well, hey, welcome everyone again. And sorry if I feel like I started this kind of somewhat somber, but I really do feel that I hope all of us can get that message out that the real form of prevention is fitness. It's so important. And I hope we take that opportunity to really make that point, really make that point with the networks that we have. So I want to start this conversation off with the startups, the innovators in this group. And since you both spoke a little bit, this is Emma and Lauren, you spoke a little bit about what your company does. I want to ask you to what extent are you actually getting people to really be more active? So maybe start with you, Lauren. To what extent has offering virtual increased membership participation at these gyms that you're partnered with?
For sure. So our core focus is the people that are members currently, and the gyms always had this fear that it would kind of cannibalize their business, but in fact, it increases the engagement. So people are working out 22% more when they have a digital offering because they're supplementing days that they can't get there by keeping consistency by having this digital offering. So that's been super exciting. And I think, the average gym user, depending on the year, goes about 1.8 to 2.6 times per week, which is not enough. And so you're not, keeping them out of the gym. They're already not going enough. And then there's 80% of the population that's not going at all. So I think we're excited that we're increasing the engagement of the active gym members and also now hoping to increase this funnel because of the points that you say. I think people definitely have because of COVID, a greater sense of awareness about the need to work out, which is exciting. And also the ability to do it at home and with tracking devices and stuff like this, you can really start to understand it. So hopefully, we'll see a bigger increase in the next year as well with these offerings from most of the gyms. Over 75% of the gyms now have digital offerings.
And Emma, so Lauren said that she's seeing 22% lift with the gym members. What are your corporate clients seeing with regards to sort of increase activity amongst their employees?
Yeah, one of the things that we try and do with our core model is that it's fully funded, right? And when you remove the barrier to cost associated with going to facilities or doing a Pilates class, right? They're not cheap. And so when you remove the barrier of cost, you automatically are going to see an increase in the number of people that might even be trying it for the first time. And so for us, that's removing that initial barrier. The other thing that we've seen really since COVID was this focus from our employers on using, and you've already brought it up, Bambi, is this really that exercise really is that foundational piece of health, right? When we talk about things like cholesterol and blood pressure and obesity, the common denominator in improving all of those metrics is to be more active. And so we're also now tying this into that mental health aspect. And so seeing increases in participation because, hey, if you move more, your mood is improved. I know for me, it's the biggest point of stress release. I just have to go and work out. But mood increases, we could become more energetic when we exercise more. And so really changing the focus when it comes to marketing and promoting fitness, that it isn't just cool, it's not trendy, but you're actually benefiting in a lot of different areas. But we match Lauren, we definitely see an increase in usage when it can be virtual as well.
You two partner with each other, Peerfit and Forte. How do you complement one another?
Yeah. Do you want to go? Are you going to say something, Emma?
Go ahead. Yeah, no, go ahead.
Yeah. So we work together. Obviously, they have a great network of people that have access. So we actually been working together before the pandemic as well. So they were kind of ahead of the curve in giving people access. However, making it accessible, whether you want to go in person. And if there's not a facility by you, then you could obviously log in and take classes through our platform. So they've been a great partner, I think, and obviously then that became further perpetuated with the pandemic and the need for that when everything was closed. But I think they've always been kind of thinking outside the box, like how to give people access and meet them where they are and lower that barrier to entry. So we're super grateful for for Peerfit, and to your point as well, you have such a wide variety of things. And I think that that's the most important thing, is just giving people access to all these different things. And working out is expensive, eating right is expensive. And so for what's so cool about Peerfit is that people get the opportunity to do these things that they may not be able to do normally. And I think that that's really the coolest, part about it, is making it accessible and convenient and affordable.
Yeah, and one of the great examples I always share when I'm talking about Forte, because this is how I use Forte, is I have a treadmill. It's really struggling. I struggle at times to be motivated to get on the treadmill, but I know that I can log into my Forte app and I can find a class that is using a treadmill. There's a great class in Boston actually that I like to do. And I can just pick one of their workouts. I can see and hear the instructor. It is though I am in the class and I just do the class, but I am in the comfort of my own home. And to me, that's a tremendous benefit.
Yeah.
I have a question for both of you, actually, especially because you are positioning yourself in a corporate environment. What are the metrics that you measure for success? And I'll start with Emma and then Lauren. So Emma, what are the metrics for success beyond engagement that you measure? Are there any outcomes or surveys that you do that you're able to share with us?
Yeah, definitely do satisfaction surveys, kind of a massive one annually, and then periodically with employers who are looking to really target questions. We customize them for our clients. If there's specific things that they want to ask, it might tie in with a benefit survey. We try and not, death by survey the employees, but to tie it into what they're already doing. But look, we also, engagement is definitely one of them, right? How are they using it? How many credits are they spending? Our currency is credits. Our users get credits to spend within the app that those credits are paid for. And so they again get to choose how they spend them. So we want to know how they're spending them. Is it memberships? Are they going to individual classes? Where are they spending them? What types of things? And that is the data that we share back with our clientele. But then we are also tracking kind of new registrations. Who are we attracting new to sign up on a monthly basis? And then the other interesting metric we like to look at is those that might re-engage, right? They registered 3 months ago. We haven't seen them use the platform for a few months, but whoa, now it's January, New Year's resolution, they've re-engaged, right? Or we try marketing campaigns specific to engage those that might have dropped off. And we see and play around with what works. It's like that A/B test. Does this work? Does that work? And it's different for different populations. Given the variety that's on our network, the industries that we attract from a clientele perspective really is quite vast. Anything from construction workers to young tech startups that you would think that this is a great fit for, but it really is for everyone. And we kind of, the messaging and communication that you use for a construction-based company is different to what you would use for a young tech team. And so we use all of that, but the metrics are really around registration, how they're using their credits and how frequently they're using their credits.
Okay. And Lauren, for you?
For sure. So yeah, we usually look at, for some of our clients are gyms, some of them are digital only, so there's not a conversion in those cases, but we usually look at the engagement and conversion of the gym's total membership base. I think what's been really interesting is that gym membership levels overall are at 97% of pre-COVID, but the check-ins are much different. And because people are doing 60-40, so they're doing 60% in person and 40% digital. So it's ever more important for the gyms to be able to reach those members where they want to be reached. I think the consumer has been kind of demanding this on-demand, do it as they want thing, and the gym wasn't really sort of iterating to the consumer demands. Obviously, COVID has forced them to iterate because they had to adopt digital, maybe for the right reasons, maybe for the wrong. It was the only reason or way to connect at the time. But I think what's super exciting is, every state is in a very different place and has had very different experiences throughout this. So in some cases, we had one that had 70% of their frozen members, or of their people not going to the gym, were using the digital product regularly, right? So that was a core way for them to keep people engaged. People also, now it's important that we, Facebook understands everything about you, and the gyms tend to understand very little about their customer. So understanding who's coming, how often, why are they not coming, and how to engage them. Gyms typically, to Emma's point, exactly, have high churn rates because people get excited in January and sort of lose that gusto. So how do we meet the customer wherever they may be? If they're coming every day in person, great, giving them ancillary content. So that's something that we really look at. A big percentage of the clients there are some gym members, in many cases between like 2 and 10%, depending on the client, that are still just staying digitally only. They like the efficiency of it. Maybe, and I think now it's more efficiency than sort of COVID fears. I think they're now at pretty close to membership levels. So that's interesting too. They just want to be a part of it and be able to access it around there. So we look at kind of the conversion, the engagement, and now people also prioritize that. So over 55% of people want their gym to have that offering. They kind of expect that. And so for us, then it's important that the gyms kind of, use this as an opportunity to reduce churn and increase retention, whereas the only way to be a member and be active was to go there before. So it's new for them because they build these beautiful facilities and they want you there. And so we're, having to get them to understand it's more important that they stay consistent and don't churn out. And so helping them understand that, and the people are leveraging it the way that we had hoped, which is super exciting.
That's great. Well, I would like to shift the conversation from the providers to the VCs to kind of hear from you. What are you investing in? What is new in the fitness space? Why are you interested in investing besides your own personal reasons? And then I have some follow-up questions to that. So I would start with Justin, since you're the tile next to me, and then we'll go to Mark and then Kevin.
Perfect.
Yeah.
Well, yeah, I think fundamentally at GSR we're focused on health technology broadly. So how are we not just improving health outcomes by the margin 10-20%, but how can we deliver care that's 2, 3, 10x better than was previously possible? And I would say, in terms of, especially when we think of health outcomes, I'm a physician, and I'd love to believe that physicians are a big source of health outcome for patients. Honestly, they're not. Most of what drives someone's health outcomes are other things, what they're doing at home, their situation, external factors. Most people estimate, the healthcare system is only responsible for 20% of that. And so, how can we work, as an investor, think about startups, find real ways to improve outcomes as our country slowly moves towards this shift to value. Exercise and encouraging fitness is a huge potential to really make that happen. Now, it's not easy, as we've seen, and we all know the numbers well. It's so hard to get people to engage in exercise. But every year we have new tools and new ways to try and engage people and move people closer, whether that's connected wearables, connected with a platform to help encourage people to work out, bring others to the table. It's never been easier to connect with peers, find a partner to go running, go to the gym, etc., to make that possible. And just build those feedback loops. So ultimately we can build the habits that, most are fortunate enough to build on today, but how do we get those people who haven't? And I think that's just such a huge opportunity. So when we step back and look, where is the potential for huge transformative outcomes in health, really figuring and cracking how do we engage in fitness, really that exciting. So we've invested in a few companies in the space, some early bets, thinking around gamification, a company called Mulu, a company called Recess, thinking about, getting, instructors, on the fitness instructors where there's so many, and helping them get to a virtual, first part where, the company can focus on, the instructors can focus actually delivering classes, and the company can help them with creating background content. And we have another investment in a larger company called Sparta Science, where, they're really focused on movement health at large. How can we predict and prevent injuries and develop very specific ways where people can measure understand their risk, and allow them to build a customized fitness platform. So they're deployed across professional sports, military, and moving into health, thinking about, again, those bigger outcomes, as that goal. How can we prevent fall, keep people active, keep people moving, which just is such an important key, as we've already talked about already. So across a number of those things, that gets us really excited. And again, as we're increasingly thinking about value and starting to be able to measure that, again, it's not happening overnight. With all these wearables, we would have hoped it happened years ago, but they're sticking around. As much as a wearable was a fun gift to get someone for the holidays, they're sticking in. We're starting to see the outcomes data. We're seeing companies like Aura and Apple and early detection on COVID, understanding changes in resting heart rate. We're getting these studies done at scale, and I think that's really going to transform into health outcomes. And so startups thinking about that, people active in fitness are what gets us excited.
Thank you. Thank you, Justin. Sorry, I was on mute, chatting away. How about you, Mark? What is new that you're seeing and excited about it in your fitness, especially because you're dedicated to that space? What is innovative in the space that you're investing in?
Yeah, I think it's a really exciting time. COVID has focused people's attention on, self-care and healthcare as well. And it's terrific and exciting to see, a lot of these fitness offerings and how technology, having spent 35 years in Silicon Valley, it's hard to escape the impact of technology, have made them, more accessible, reduced costs, really, encouraged, improved, and I think had an impact on activity and working out. But for me, when I see these, I think too many of them really are siloed. They're like, hey, we're going to help you with your meditation or your mental health or working out more. We're going to get you to do more workouts or work harder. There's nutrition over here. And then there's primary care that's gone to telehealth and virtual visits. But they all, to me, are very, very siloed. And I believe strongly, many of us have been around healthcare, but it's like, you can't out-train a bad diet, as an example. These things are connected, right? And so to me, the most interesting opportunities are ones that start to combine these and start to put together a holistic and customized, if you want to say personalized, but customized experience for the individual or client. Right. And if we're talking about fitness and health, it's if the system knows what you're doing to train or what your activity is, either through the fact that you're using a digital platform for training or you've got some kind of fitness tracker going on, well, that should inform your diet and what you're eating and how much you're eating that day. Right. Mm-hmm. And if we can find ways of making that really accessible and easy, and it's not just, telling people to eat less. It's about what to eat and when to eat. And the simplest offerings are, here's menus, but we have home delivery of food services that can make that, again, technology, make it super simple, very accessible, bring down the cost, mental health, work that in. All of these components, to me, if we can integrate those, that's where the real magic is potentially, and where we can have the biggest impact at a societal health economics level, as opposed to these great offerings, but ones that are silent. And that's, I think, how I'd answer what I'm excited about right now.
Hey, Archana, I want to ask a follow-up question for you, Mark. And I think a lot of companies, ultimately, when they get big and if they want scale, they have to broaden. But I look at the diabetes space or chronic conditions, and I think of a couple of companies. You had Livongo or Amada that just went, focused on either diabetes or pre-diabetes. And then you had one company, Vita Health, that focused on cardiovascular, hypertension, diabetes. And it seems, I don't know if fundraising is any guide, but if you look at, which company has raised more, you had Livongo, focusing just on diabetes, expanding, Amada now expanding into mental health. But at some point, in the beginning, you have to start focused and then you scale, wouldn't you say?
No, I think that's right. Although today, I think you can try to come out with, hey, this is our goal from the get-go. So what is it we need to do today to position us to succeed and achieve those goals? And it's really interesting, again, to me, it's not maybe siloed, but we're getting this sort of convergence of those who come from either the fitness or consumer-facing side and type of businesses, and those on the healthcare side who've thought about these as, you mentioned diabetes, diabetes, congestive heart failure, those kind of things, those always rise to the top in the disease management world. because that's kind of where the dollars are, and that's where the payers see the highest, impact ROI, medical loss ratios, those kind of things. You go and talk to somebody who's in the training world, medical loss ratio doesn't mean anything to them. But it's really important to a payer. And what's great to see again is this convergence of, and it's especially, I think, most prevalent or obvious when you deal with large employers who see the whole economic picture, right? Mm-hmm. That they do understand these impacts. And it's not just about, oh, with diabetes, I can see a change in my medical loss ratio in 12 months, and therefore it's worth me spending money, as opposed to, well, if I reduce somebody's weight, that's going to help over 5 to 10 years. Most health plans don't want to pay for that, right? But if you're an employer, the consumer, ultimately, those are valuable, important for society as well. So I do think we can get there. And I think startups can target that from the get-go, even if they start off simple. I don't know if that answers your question, but that's the way I think about it.
And Mark, I do have a question that was actually directed to that later on, but I would absolutely support most of the fitness startups that have baked in metrics that is able to influence clinical outcomes. That would make a lot more sense for employers and even payers, because that's where the ROI becomes much harder. For a fitness to have an ROI, it's a perk. It's kind of sits in a benefit package that attracts talent and retains talent. But when you start tracking the outcome that is being influenced both in musculoskeletal space, mental health space, diabetes, heart disease space, now suddenly you've really crossed over. And I mean, I'm going to use the word Peloton is trying to do that with United Health Group and others. They start to like dig deeper into cardiovascular, and we're starting to see that kind of crossover and mingling of that swim lane, so to say, between fitness and healthcare. And I'm personally excited about it as we look at solutions on the horizon.
Yeah, no, you're absolutely right. And I love fitness-oriented companies, but they tend to focus on, how many sessions are there a week, and what their engagement metrics are, right? And they may have some other factors they follow, but, if you're from the health side or you're an employer or a health plan, your metrics are different than that, right? That you care about. And I don't see as many health fitness-oriented apps that track that or focus on developing that.
And what happens is when you're in the fitness space, you lower the barrier for that individual. When you say, I'm serving up a diabetes management solution, people are already scared of conditions and they're kind of reluctant to engage with a diabetes solution. Instead, they're more willing to engage with a fitness solution, which makes them feel good about their own health. The other aspect is productivity. So if you can measure health outcomes, productivity, and diversity of people that you're engaging with other different conditions, that would be extremely valuable for an employer. Kevin, you're next for that exact question. Is like, what are you excited about? What's the innovation you're seeing in this space?
I mean, all this stuff is super exciting. I think to kind of take a different angle on what we've already been talking about, it seems like in the last 5+ years, we've been trying to figure out what we can measure, how we measure it, and how we get it in front of people. And we've left a lot of the analysis up to individuals, up to maybe primary care physicians at a single point in time. And we're slowly transitioning into this really cool phase of what do we do if the experts can have more continuous data on individual health, on group health, on outcomes post-specific events, like as Mark said, payers are actually paying attention now, which is huge because I don't know many others who have as like outside of large health systems as much data on group health outcomes as them, and something they can actually do with it. But I think the easiest way to think about it is looking at what like Ford was doing, a couple of years ago, I think in 2017-ish when they started. And they said, listen, like your primary care physician sees you maybe once a year. They take a bunch of vitals and they look at how your vitals are on that day. That doesn't tell you a ton. It can give you a snapshot of how you're doing at that point, but it would be more helpful if there's a couple things you want to track, and we'll give you some wearables, some connected devices, and your primary care physician will now be over chat primarily, and you can go in whenever you want. You can do whatever blood tests you want, and you get a more holistic view of what's going on with your health. And kind of fast forward to now, and lots of people have Apple Watches, Whoops, there's levels, people are doing personal training virtually over like Future.fit. And there's so many different angles that we're collecting different data from. And to kind of all your guys' point, a lot of it's very siloed right now, and we're starting to think about how to connect these things and pull out meaningful insights and get that data in front of people who can actually look at it and tell you what you need to know when you need to know it. And COVID and kind of rising insurance costs on the health front have been kind of a forcing function for making a lot of larger, slower companies that wouldn't have typically looked at new health solutions, kind of forcing them to actually change and try out some new stuff and maybe take a chance on a riskier pilot that they may not have even looked at a couple of years ago. So if somebody's able to come in and show them how they're doing something in a very with a very specific disease and say we can cut costs 75% if we work on preventative care in this and this space, or if we do this kind of post-event recovery program and we help you track it without adding more more headcount. These things are all super exciting, and we've worked on a couple companies in this space. We've looked at we're helping out a company called Recora that's working on post-cardiac event care, and they basically help doctors who focus on post-cardiac event care or anything cardiac related. They help treat their patients after they either go through surgery or after they have a cardiac event, and are able to increase positive health outcomes, basically just by helping people stay with the stuff that they're already supposed to do, and enabling their existing doctors to track if they're doing it or not, and then piping that information to the right person. And I think there's a lot of stuff that's still kind of unsolved. There's so many different angles you can take on improving health outcomes in the US. I mean, from the food side of things to fitness to primary care to specialty care. I mean, it's really exciting to see what's going to pop up in the next couple of years.
I think what I'm hearing here is that just from what everybody was saying, is that really the big opportunity is to get these new connected fitness devices and change the model, change the sort of paradigm around how these fitness companies are seeing themselves, and really having this integration with health plans, because now they're realizing that they have to change what they're paying for to reduce the cost down the road. So I want to throw out a model here to see what you guys think. Could it be that a health plan incentivizes people to work out? So let me give you an example. One, you step into a gym, you get $5. You measure your BMI, you measure your cholesterol, your glucose level. All of these have to be healthy at healthy levels, and then you get a certain amount. Maybe you make $50 a month, and it's about $150 a month to go to the gym, but you pay $100. The health plan kicks in $50, right? But for the health plan, this is great. This is upfront cost to reduce that, down the road. So if a diabetic costs $12,000 a year, the health plan would be willing to pay $2,000 a year for a person to reduce that $12,000.
Bambi, I love that idea. And I think we've certainly seen it and tried it on the employer side for a decade or more, right? Employers are far more motivated to incentivize their populations around healthy lifestyles. Look, it goes back to completing a health risk assessment and doing their biometric screenings, right? back in the day. I don't want to age myself, but those things were definitely financially incentivized from an employer perspective, even if it just meant, hey, if you do your biometric screening and your complete your health risk assessment, you'll pay a lower premium out of your paycheck. I mean, those things have been tried and tested. I think we kind of got to a point in that realm where the employees started to feel like it was a big brother, because then we advanced to, okay, I'm going to pay for your gym membership, but you have to go 4 times in the month, and you have to prove that you went 4 times in the month. And so that put pressure on fitness vendors and gyms to provide that data, which I think needed to happen anyway. But I agree. I think health plans need to get there and really shift their thinking on what it is they should be paying for and what it is they shouldn't be paying for.
Yeah.
And life
And
insurance
I
too has
think
done
if it
kind of the
was
same.
started, I know this has been around
Yeah.
for a while, but I think we're all trying to, what we're seeing is that we have this sort of Overton window, right? Everybody's starting to realize that this is really important, including the consumer, who's willing to say, okay, I got a big brother here. I'd rather have a big brother telling me to work out than, wear a mask and blah, 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 and do all of this other stuff. I just rather have a different type of big brother. So I'm just saying that I think now is an opportunity for models to change. And I guess to Mark's point, so what are the models around integrating fitness and health plans?
I think one of the biggest hurdles that health plans have to overcome is that they're not consumer apps. They're not fitness apps. They suck at designing user experiences. And like, for the most part, they're incredibly hard to figure out if you don't know what you're doing. Even if you do, I mean, they're confusing. So it'll be interesting to see how they approach this. And right now, a lot of it seems to be that, different programs get outsourced, and there's a chance for other companies to kind of build stuff, and health plans will leverage their expertise in working more directly with users, but in the short run. But it'll be interesting to see how it kind of comes together in the long run.
Yeah, I think the challenge with health plans, although ultimately they can be I think a real force for good, is they do have certain sort of business model constraints. Some of those implications being the turnover in their roles, right? If you have a patient who doesn't stay with you for very long, which is the pattern, people, re-up each year and they switch plans as employers change the economics. It's not a great incentive for a health plan to invest in your long-term health. And we've always had this disconnect where the payer versus the consumer in US healthcare are separate, right? And that again represents a challenge here. It doesn't mean that overall it can't be integrated, but again, it just takes a much more holistic approach and a bigger picture eye to it to, I think, make it all come together and align. We've got to get alignment of interests. And that's been the challenge, I think, on the healthcare side, or the healthcare payer side.
Yeah, to
Agreed.
build off that, like what you were asking about, Bambi, why don't they just say, okay, you move, X hours a day and we'll discount your plan by 10, 20 bucks, whatever it is. It's like they are starting to think about that, but on very, very, very specific cases where they've done the math and can say that if this happens and we do X, Y, and Z, and we look at the number of people who have gone through this exact event before, can we push them into a path that would cost us less, and has already been proven to cost less in the long run? And by the long run, I mean, as long as we keep the customer. So they're going to look at how long they stay with the health plan. They're going to look at how much it costs. So they'll probably go after the stuff that, results in catastrophic outcomes at the beginning. So something where, this one smaller event happens and then it kind of snowballs and they're forced to pay the rest of it. They'll probably try to go attack the ones that have solutions that people are not necessarily following perfectly, and try to build stuff that addresses that before they go with more general stuff that does matter and does actually result in better long-term health outcomes, but might not be immediately provable, or might be 20, 30 years down the line instead of within a year.
Well, and The couple comments. One is for Mark's comment is it is very true that people roll over from one health plan to the other, and that's the big reason why health plans are not incentivized to really embrace something like what Lauren or Emma are offering. The issue is that ultimately they do end up paying whether they like it or not, because cumulatively the risk of the population keeps increasing.
Yep.
So unless they partner together to create some kind of foundational level offering across all health plans, this is going to come back to them regardless, especially on the fully insured plans and the Medicare plans. But when we look at commercial or employer level, sustainability is an important part. So, $10 here, $5 there is just scratching the surface. Look at where we have been successful. We have been successful in smoking cessation. And why, how we did that is by creating environments for people and making it easy for them to quit. It wasn't that we started with incentives and it didn't work. People would stop for like 3 months and then go back to it. But once we created smoke-free environments, that's when we truly started digging into making true changes. So a few things when we were, not a hybrid workforce, but we were coming to work, we did redesign the cafeteria was one of the things to eat better. We're putting fitness centers and walking meetings. Some of the hybrid workforce things that we have done is start a meeting 5 or 10 minutes later so people can have some walk time or some other time that they could move around from the desk, or leadership do walking meetings so that your top-down approach to promote movement is there. And then of course, incentivizing devices like standing desk and working bikes and things like that. That's also very successful.
I think Mark brought up a really great point earlier, though, just about diet. I think that's the bottom line. I always say you can eat right through a workout, and at the end of the day, diet is number one. And the plans focus on fitness stuff, which is fun and exciting to offer, but the benefits in terms of getting these healthy meals and all these amazing things are not so supported. So it's interesting because that really reduces risk factors very quickly. Will also probably encourage and increase more people to work out. So I think there's certainly a huge disconnect there. MyFitnessPal, which is a way to track your food, which, it basically shows you, exactly to Mark's point, how much you're moving and what you are then owed to eat in turn for that. And hundreds of millions of people in the United States, about 300 million, I believe, have downloaded that product. So people it crosses their mind. They yo-yo, they go in and out, they use it, then they get off it. And so people are in that regard interested in trying to understand it, but obviously it's not working, right? There's not 300 million people falling into greater health from that. But I think the interest is there from people because they have this heightened sense. So I think it's really important that we connect it. I think the wearables are cool because, to Kevin's point, you may go to the doctor and be lean and look good, but you may not actually get your heart rate up. You may not actually be that fit, even though sort of on the outside looking in, you may look like you're in good shape. And I think that's where the wearables are cool. From the consumer side, we integrate with all the wearables and have live leaderboards and, try to give insights that are fun and exciting to encourage people and show them that their workouts are, their heart rate is not getting so elevated because they're getting fitter and their recovery is better. So interesting, fun ways to make the wearable fun for the consumer. And then also, I think it's important to be able to use that data and give it back to the insurer. So using the same tool and the information that's going to the two parties in a different way. And I think it will be, now you go to the gym and you sign a paper for your insurer saying that you were there so many times a year to get money back. That seems pretty rudimentary in the world that we live in. It's like mailing a letter to somebody to conduct a business deal. It's like this wearable should just transmit to the insurer how much I'm going, how much I'm getting my heart rate up. And that seems like that is a very easy thing to connect with the technology. And so I really hope we can start to close some of these loops, right? And the doctor is telling you to go work out. Well, where do you go work out? You go to the gym, then you can work out on platforms like ours and you have a wearable and it's subsidized by your insurer. So it's all fragmented. And I think that it's a conduit to really connecting the people, telling people that they need to get healthy, providing them a way, an affordable way to eat better. And most people say they need to lose weight before they want to go to the gym, which ironically enough, doing either of those things is good and it doesn't matter the order. But I think providing all of those things is going to be really important. And then obviously having a fun means to staying active at the end of the day that works for people is going to be important too. So hopefully, we could start to see people stitch these little pieces together.
Is that happening with Forte? I mean, I think there's an opportunity here with gyms, especially because the very young, 20, 30, even 40-year-olds, they don't go to the primary care doctor, right? But they do go to the gym. So there's an opportunity there for the gym to capture some of this, these vital biometrics that can sort of be integrated into their, into their medical records. Are you seeing that with the gyms?
So that's the other, like, the medical community or doctors, or they can actually be, if they work together, they could funnel more people into the gyms. And they do have actually programs for silver sneakers for older things where they do support and cover some of the classes that are taught within those facilities. And they do have communities too where people are at risk and they subsidize the cost, but it's not, and it should, everybody wins if they can get more people in those doors, but it's not a succinct process. I think it's still not the wearables. Some companies are giving out wearables and they're counting the steps and they're rewarding people for that, but it's still not as simple as just transmitting that information. But my good cholesterol is actually extremely high, and my doctor was like, I didn't even know it could go this high, and she was like, I would be alarmed that you actually have a certain health problem if she didn't know that I worked out all the time, because it also is triggered by being super active. So even just like things like that, but she's like, if I just looked at your blood results, I would actually think that maybe there was a health concern, which was super interesting. So even just having holistic information, I think, in general, to your point, but it's still not connected end to end.
I think one of the barriers too from the gyms, there's a couple, right? How many of them have the sophistication in software technology to be able to make that transfer? The other is kind of ownership of that data. And hey, if I'm going to share it to a health plan, I'm going to charge them for it, and health plans may balk at that. So there's this topic of money, and I think that transfer of data and ownership that are things that cause or add to this issue of connectivity.
Yeah, I think that's where startups like yours and Forte come in, right? These new startups that can capture that data from these gyms. Let's switch gears a little outside of business model. And Justin, this question is for you, just for some of the companies that you've started, that you invested in, like Sparta Science, which is really intriguing. And I checked it out, and it all is about assessing your risk, right? So, which is really cool. But as I get older, I'm far more risk averse. And it's sort of, when you understand your risk, you have this fear and it sort of suppresses your initiative. So I'm really curious as to how this company you invested in is sort of changing the way people look at their workouts if they know that they're at risk. You're heightening their awareness of a certain risk that they might not have even known that they had, which could be a bad thing, could be a good thing, but could be a bad thing.
Yeah, you certainly, the last thing you would want to do, and if you hear Phil talk about what they're doing at Sparta, the last thing you'd want to do is discourage someone from working out. But where Sparta's really seen a lot of success is when you take longitudinal measurements of someone, and just like with wearables, with measuring their heart rate, et cetera, if you take a longitudinal estimate of how is someone moving, you're working with pro athletes, you're working with people in the military who are constantly body under stress, all of a sudden you see a change in someone's risk profile. You see something's happening, their recovery isn't great, they're moving differently. This is a signal, a movement pattern that is much more likely to think about injury at that time. It can be tremendously powerful to get everyone looking at the same thing, everyone looking at the same metrics, from the player, the person themselves, from the training staff, from the coach, the leader of a squadron, to understand, okay, this person is at risk. Maybe they're not ready to come back. They're coming back for an injury. Maybe they need more time. Maybe they're not the right person to deploy. And so what Sparta has seen and has really worked on figuring out outcomes. They worked with a large study at University of Pennsylvania to show a huge reduction in injuries when all of their athletes were measuring at a consistent fashion, seeing when they're going to be at risk, and then reducing actually and preventing those injuries from happening. And then taking it all the way, and I think Mark mentioned this a little bit earlier on, which I think is absolutely right. We need companies thinking about fitness not to think of themselves as just engagement, how many gym sessions do you have, but tie it all the way to health outcomes, where that's what's really been missing. And I think that's one of the reasons we got so excited about Sparta and what they were doing, is they kind of took it end to end of, yes, we're going to start with the highest cost people, at first, which is professional athletes, people in the military, where the huge cost if they kind of go out from the workforce. But as you're really moving that toward in their homes, how can we prevent falls elderly? When we kind of see someone or measuring them, instead of jumping on a weight scale, why not jump on something like Sparta? So you can see, okay, what is that risk of falling? All of a sudden someone's okay, and then someone all of a sudden wakes up one morning and has a big change in what they're doing. Everyone, that the patient themselves and everyone in the care team can know and have call this to attention that something might be going wrong, something might need attention for what's happening. And so, we just like with if you measured your heart rate or your other vital signs that we do all the time, in the inpatient or outpatient setting in healthcare, we have no way to measure our musculoskeletal health. There's no agreed upon standard. There's nothing we're able to do. And so we got really excited about what Sparta was doing, because they have a unifying measure. They're backing it up with kind of rigorous clinical data. And as they're starting to continue moving across a number of different sectors, we're really starting to see, again, those outcomes for reducing that injury, the total injuries to the populations, which ultimately is what we're all shooting for.
You talked about measuring or capturing if an elderly falls. How do you, so is this a product that actually goes into somebody's home?
Yeah, so they're actually working with a number of healthcare facilities. And so rather than stepping on, think of it as standard scale, you can step onto a Sparta scan, getting someone's likelihood, measuring their balance and putting them on a distribution for how likely is this person to fall. And so by taking consistent measurements of this, everyone around the table can understand, okay, these are our high-risk patients, and falls are incredibly costly, obviously to the patient, if someone is falling and ending up in the hospital, ending up in surgery, and to the health system in general. These are health system measurements that we take to understand kind of the quality of a facility. And so I think it's a really interesting opportunity if we can work and prevent falls from happening. There's a huge popular stance to benefit.
Yeah, I mean, yeah, if we can prevent falls, but they're sort of identifying who's at risk of falling. And I just wonder if you can't just look at a person and just say that person has terrible knees and, weak knees, and they're definitely at risk for falling. Right? So
well, exactly.
And
that's
I believe
the standard. That and a timed up and go walk test. We're stuck gauges for assessing someone's risk.
I mean, those health plans specializing in kind of the over 65 population and SMS, there's certainly reimbursements for them around fall prevention programming on a per member scale. We're looking at that kind of thing for we have a product that's our MOVE product, and it's for the over 65 population. And health plans are always asking, what are you doing for fall prevention? Because they can get reimbursed at a higher rate if they're offering those kinds of services.
Is there, you brought Emma, you brought the health plans back in, and now we've already realized that the health plans are
sorry
about. That's okay, because that's sort of, they are one of the payers, but there's also the consumer out of the health savings accounts, and that's what CrossFit Precision is doing now. I don't know if you guys are familiar with CrossFit Physician Care. I sent a link to you guys. So it's the CrossFit company, but now they're becoming a direct-to-consumer healthcare company, and they're a healthcare company because they're eligible to be covered by health savings accounts. And I imagine there's probably lots of hurdles that you have to go through to be HSA eligible, but that seems like a really good way to one, give the consumer the power to make their own payments, right? It's not the insurance company. And it's also there's some tax savings there. So what do you guys think about that road of, these fitness companies really trying to become sort of quasi healthcare companies by being HSA enabled or eligible.
I love an HSA plan.
Yeah.
Sorry, and I'll be quick, but HSA plans attract those that are typically already healthy. They're not going to be attracting those that have pre-existing conditions that are quite costly. There's preventative medicines that are quite costly. And if the employer is offering an option, you do the HSA or a traditional plan, those that are less healthy are more likely to choose the traditional plan and therefore not have the money banked in an HSA to purchase or go through those types of services.
I didn't realize that. Why do you think that's the case? Why are those who have HSA more healthy?
Well, HSA is where they are paired with higher deductible plans. So then the individual is assuming risk, a lot more risk upfront, and HSA becomes like a cushion for them for catastrophic, and they can invest. So they're generally, if you look at the HSA plans, they're generally younger, healthier, invincible type profiling. But I would count most of the folks here who have a solid health hack to be included in that. But also, people who are financially a little bit more secure, they tend to take more risk onto assuming some of the out-of-pocket cost. So I'm going to pivot a little bit. I know Bambi is taking care of something else, but I want to ask our VC panelists, would you add companies that are crossing over into healthcare, fitness companies that are crossing over into healthcare, at least the outcomes, as table stakes for your investment already or go forward? Or are you asking them to build that out? And I'll begin with Justin again.
No, not necessarily. So I think, you want to understand the entrepreneurs. I think, Mark Lynch you want to understand the entrepreneur's vision, and execution is everything and being focused. And so he wants to first build an engaging product that is only going to lead to these health outcomes. If that's the vision of what they want to do, then, that could get us excited. And so even if those exact metrics and tracking and outcomes that we've all talked about that want to see in these companies, even if they don't exist yet, I think if it's in the vision, it would be in scope for what we're doing. But I really think it's, that's what we're missing still. I think, Mark talked about this. We don't have a unifying platform that really crosses over all of these things. And I think there really is an opportunity for a company who, gets the user, which is core, gets them engaged, gets them excited, and then brings it all the way to great outcomes for health plans and getting people engaged, maybe augmented with the right wearable. So, even if it's not built yet, if the vision's there from day one, then we'd be excited to be a potential partner.
That's great. And how about you, Mark?
Yeah, I think I'd answer it very similar to Justin. It would almost be an episode of Silicon Valley to have an entrepreneur walk in with a vision for what they wanted to do, and then the VC say, "Oh, that's great. You want to build the best, Pilates experience in the world. Why don't you do that? But at the same time, let's address diabetes and improve health outcomes." Mm-hmm. That's not the right match. That doesn't work, I think, for a VC to step in that way. We'll wait around for someone to align with what we get compelled by, and that won't be every opportunity. But there's another VC right around the corner who may still love what that entrepreneur is doing, even if we don't. But I don't think we should be directing them at that level.
Okay. How about you, Kevin?
Pretty much the same answer. Totally depends. Although from like a founder's perspective, I think it's super important to find a VC that looks at your vision, believes in that, and wants to enable you to achieve that vision, right? Like a lot of stuff, if you're deciding to go after any sort of insurance payer, if you're trying to go after a health system, make sure they're patient people. It takes a long time to get in and find a way that you can work with some of those larger payers. So yeah, just find the right partner.
Great. Awesome.
I want to bring Emma. I want to ask this question to Emma because I don't know if I really got the answer. Not that I asked Emma, but I'm trying to understand from the so let me back up. So I have Kaiser as my insurance company, and they actually offer ClassPass and they actually offer Calm, but actually never really knew about that. And they could actually push it more, but they don't. And so I'm wondering, what do you do to get, to encourage your clients' employees to take advantage of what you're offering? And what are they doing? Like how much money are they putting into it? And then what kind of ROI are they looking for?
Yeah, it's much easier to push engagement and registration on the B2B model, right? Because the employer is making this investment themselves. They're the one paying for it. It's similar to the health plans. Our health plan clients, some are paying in full, some are kind of passing the cost on to the employer. So it varies a little bit, but that is definitely a struggle in making sure, as you've identified, you may have a benefit being with your health plan that you don't even know about. And we certainly come up on that with our health plan partners. And there's only so much they are prepared and willing to do or have budgeted to do. So for us, it's really about getting at least 1 or 2 employees within every workplace environment to engage. And then it's interesting what happens is that trickle down effect. They start talking about the benefit. We encourage and incentivize them. Hey, if you bring a friend, we're going to send you a Peerfit t-shirt. Everyone still loves a free t-shirt, I can tell you that. But we incentivize them to bring their friends and send the message organically through their organization in situations where we don't directly have contact with that employer or plan sponsor, as they would refer to them as. But it's definitely a challenge. We launched a program this year with our clients that was a registration campaign. Typically, the way that that a client would engage in our platform is that we get an eligibility file. On that eligibility file is the bare minimum of information, right? It's just enough to connect the employee when they register with the benefit. We don't get email addresses. And so until they register, we don't have a way to interact with them. We can only interact with those that have created an account on our site. But through our registration campaign, we volunteer. If the employer would like to share their employee emails, we will take on the burden of promoting the program on their behalf. And if you're working with HR people on a day-to-day basis, wellness is typically the other job as assigned on your job description. It's just something else they're assigned to do. They may not have a passion for it. They've just been told that they need to do it. And so when we volunteer to kind of take over some of that introductory and launching of the benefit content, that they'll gravitate to it. We just are less successful at the moment in getting our health plans to do it because they don't want to send or share information about their membership.
So I said this earlier, I think we have an opportunity to really push fitness and diet and these preventative measures and make that a good and make that the prominent messaging around COVID. What are everyone here, what are your thoughts around like what companies can do better in terms of promoting health and even connecting it to COVID, promoting these preventative measures and connecting it with COVID, and one way to actually prevent COVID as well as chronic conditions? Is there an opportunity, or am I not, or am I just seeing the opportunity?
Definitely an opportunity. One thing we've approached our health plan about is, what if you were to put the Peerfit contact information and our website on the member card, right? We all go to the doctor. We know who to call for our prescription coverage. Who do I call for my fitness coverage? Put us on the card. Again, it's going to be, as Kevin earlier identified, that health plans move really slowly when they're making decisions to do things. We have to be really patient, and it's going to be one of those things that I've got to keep bringing up. But if pharmacy and urgent care are important enough to put on the membership card, perhaps fitness is too. And so just making those things a priority and getting us more front and center in the messaging, I think could pay off.
I'd look towards, what is the best vehicle to deliver that communication?
Yep.
Because I'm not sure it's the payer or the employer always. I think that sometimes gets tuned out. So are there other channels or messengers who can deliver that, either because they're a trusted source of information for that individual or group of individuals, or simply because they're a set of communicators that people pay attention to, right? Because they're entertaining. So I'd be looking for that. I'd try to be creative along those lines, I think.
I think, sorry, can I add one thing to that? Yeah, I think he has a great point, actually. So what's so cool with us working with the UFC is they have 600 million fans, but they don't have 600 million gym members. So to Mark's point, taking people that people love and to watch and to hopefully have them be the messenger of getting them involved. Mark doesn't know this, but we're also talking to 49ers Fit, which is the gym of the 49ers, right? Like, people are so inspired by football and athletes, and we power the NFL's Players Association. And so we're starting to go down these other channels where sports investment is going towards gambling and drinking and things like that, but also trying to use these people that people love to give a really cool message to people as well. And hopefully, these people are so passionate about working out. So we're trying to use some cool messengers like that in a roundabout way as well, which I think is a new and different way to approach it.
Well, I agree. I think the influencer route is one of the ways, but the other one is to look, especially when you're working in employer or health plan space, to look at who do they utilize most. And in our environment, we noticed that the trust center was with the primary care that was offered on site. And so all of our programs were then heavily promoted through that, instead of it coming down the benefits pipeline or through the employer or the health plan. It was easier for them to hear from their clinician or the nurse that, hey, you got this fitness program that you could utilize. And that was a really good way for us to communicate and promote or co-promote.
Yep, that's just another influencer.
That's
be a professional.
A less sexy version.
It is another influencer. I wasn't restricting it to entertainers or celebrities.
Yep.
Yeah.
Hey, everyone needs to be an influencer.
Even if it's you're influencing your one friend, I think that one of the big stats too, that most people need to go to the gym with community. Like 2/3 of people need to be a part of a community. So I think what Emma said, which is a great point, is getting that like super user within that community to become the local influencer, because it may not be the HR person who hates working out, right? So empowering the super users, right? Like Peloton has these crazy Facebook groups, like those are the lifeblood of the company. So really elevating those people to influence people around them, I think it has a social peer pressure network effect that we actually try to do with the platform, where you follow people and kind of, as social media gives you that same pressure about feeling like you're missing out, we're trying to slightly use some of those same tactics to encourage people to stay active. And I think that social community element is a big part of it as well. So instead of just giving people the tangible, programming, but how do we bring them together? Because innately we're social beings and want to fit in and want to do what others do. So bringing that conversation together, I think, is another important element of it.
Well, now that, and we have about 5 minutes left, but now that we have all of these options, access points with virtual, we have like Forte is providing with all these virtual classes, and then also these in-home gyms, these connected gyms. Now that people are aware, because of COVID largely, that we need to stay healthy, and one of the best ways we could, reduce risk of fatalities, even with just with future viruses, we need to stay really healthy. Will we see more people working out, or is it always going to be the 20-80%, 20% work out, 80% really don't. I mean, is it, will we get more people?
If COVID hasn't shaken them, I don't know what will.
No, on a note of optimism, there have been public interventions that work. And I think actually smoking cessation, it's arguably one of the best public health interventions, that our country has done in terms of improving outcomes and actually making huge societal change. And, I love that comment, Archana, you mentioned, I think before, of how do we change the environment and how to promote this? And, I'll say it's going to come just from the providers, that's for sure. We've been trying to tell people to exercise, lose weight for years. And so I think it's going to take everyone. It's going to take the entities, employers, ability to track, potentially some, top celebrities as well. So, but I think we can do it. We have done it. It's not easy, but as a note of optimism, I think we'll move in the right direction.
There's a lot of people.
I'm optimistic too. And you mentioned it, Justin, smoking cessation and seatbelts are the two, low-lying fruit, as you would call it, from a societal standpoint. And it's great to see those tackled. Diabetes is probably next on the list, I think. But Strava has really good data that shows people were more active in the last 2 years.
Yeah. There's also
so that's encouraging.
Kind of scarier data on weight gain mid-COVID, where I think, as most people in here have said in one way or another, diet is like inextricable from kind of your health. Even if you're working out well and you're eating like crap, you're not going to see the outcomes you want. And for the majority of the states, it's not super easy to eat incredibly well and healthily, and have it be convenient. I mean, in California or San Francisco specifically, we're pretty lucky, and you can go down the block and find a high quality, relatively cheap restaurant that's pulling food from some farm up north or inland a little bit. And if you go to some other spots in the States, or the majority of larger cities in the States are kind of along a lot of the highways, like you pull off the road and there's 7 fast food joints right in a row, and the cheap, healthiest spot you're going to find is like a Panera. And not trying to knock that. That's great that there's so much food available for people to get easily, but similar kind of smoking cessation, right? You got to kind of think of maybe approaching the diabetes epidemic or the weight and health epidemic is as a kind of situational problem where you can start to nudge some of these folks in the right direction, where maybe all of a sudden we can make McDonald's the healthiest option on the street. I don't know if that's gonna happen or not, but pushing changes like that would be interesting to see, and also probably pretty unlikely. But yeah.
In China, McDonald's actually put bikes in the restaurant.
I saw that.
If you saw the article, but it was certainly, and it's not a joke. It wasn't a joke article. It was actually a real thing, which was quite funny.
You put bikes in there so you can eat and bike.
Correct.
At the
Correct.
time.
Yeah, I think
you're gonna need to be in there for a lot longer to bite that Big Mac off.
I think the smoking cessation example is a great one. There's a lot to be learned from that. The way that we kind of everyone rallied and nudged, we have been tremendously successful.
Sorry, go ahead.
If you notice, more than genetics, your zip code matters, and your longevity and your overall health. So if you're living in, I will call Santa Clara County, you're more likely to live longer and probably have a higher walking index and availability to all that food that you're talking about. Geisinger actually had food prep programs for people to get self-confidence and get educated in making healthy food, because most people are living in food deserts, that they had Twinkies as like the main source of breakfast for folks, because they did not have anything that was out of packaging that they could consume. So we need to think environments of folks need to improve, and there has to be a ground up effort if we truly want to dig into this pandemic and dig ourselves out of this, because it's not just about COVID, it's way more than that.
Yeah, that whole premise around that healthy environments can be engineered. When I lived in Utah, I was part of the Alliance for Cardiovascular Health in Utah, and our role was, we were all volunteers, but was to approach city planners, and when they're designing neighborhoods, to make them walkable and have shared pathways, so you can not only walk but bike, and make them safe and well lit. And I think of even those things that I've participated in the past, where it's kind of, you wouldn't think of a city planner to really have a role in here, but they absolutely do.
Yeah.
And engineering healthy environments also doesn't have to be physical. You can also have, engineered digital environments, right? So I kind of referenced earlier, like having the past of like figuring out what we can measure, how we can measure it, and how we can digitize it. We're kind of moving more, or in the middle of, I guess, into a time where we have a lot of data on ourselves. We can measure a ton of stuff, whatever we want to measure, we can. And now we're moving into an environment where we need to figure out how to synthesize that and put it in the right context, right? So like, I don't think anybody would have thought that a new fitness band would pop up in the last couple of years, but Whoop has gone from relative obscurity, and I mean they grinded it out to get to where they are now, but they're everywhere. I mean, pro athletes all over the place want to use Whoops. Like I've used Whoop for a while, ended up ditching it because I didn't want to wear 2 watches, but
That's how I feel.
But like it engineers an environment where you start to think like, if I want to work out and I want to be physically active, they give you a like readiness score that pulls in your past workout data, that pulls in your sleep, and it says like you are good to go to a certain extent, not good to go, and they give you a numerical score, and you can see like, okay, everything I did for the past week has put me in a spot where I'm ready to get the best out of my workout, the best out of my golf game, ski weekend, whatever it is, and you can kind of back solve to that. So it's like similar to the smoking thing, in which they made it so kind of difficult to smoke socially and all the time and in every location, that the logical decision was to stop smoking, or to maybe smoke less, or to smoke in certain situations. And like eventually it had this kind of effect where it moved the whole crowd towards not smoking. And like you can kind of see the same thing happening with engineered virtual environments like
there's definitely like a
perform.
marriage between like that physical space and then policy to kind of back it up, right? Which is what we saw happen with smoking cessation.
I also think it's the sensationalism around it, right? Smoking was like cool and sexy back in the day, which is, and it was what cool people did. And so then that really turned into the opposite of that. Working out is sort of similar too. Like my parents are very old school. They like think I'm crazy for, like, you're going to work out. Like I'm going to do something unhealthy. I'm like, no, actually you're not working out is actually the dialogue that's crazy, right? Like, I think it's also changing the communication from not somebody that's neurotic about their body and does it for vanity, but is concerned about keeping themselves strong and healthy. So changing the language, it's like, you do certain things to be well, and this is one of them, right? And changing the language and narrative around it, as opposed to, well, she spends her whole morning working out, right? Like that's the language. They're a workout freak. And it's like, no, actually you should be more of an outlier to not make it a part of your lifestyle, and changing that dynamic, like smoking did with the way that it was talked about and sensationalized, and then obviously became the opposite, right? The commercials at the end were traumatic. So I think that is important as well, just the way we talk about it.
I think the narrative is really key, how we shifted our narrative around sleep. Like people say, I worked so hard that I couldn't sleep. I worked through the night. That's not.
Yeah, you're a warrior.
Well, it's not rejoiced anymore, because you'll be non-productive the next day. And the same thing applies towards asking for help when there's mental health need. It's no longer, or at least much less stigmatized at this time than it used to be 5 years ago. So I do need to jump for a next call, but it was so nice to meet all of you. Thank you so much for joining the panel.